Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in their profession. Today we'll be seeing about history taking. So history taking, we day to day in life we do the history taking. How we that if we are seeing our friends after so many long days, we ask how you are feeling, how was your journey. So in order to identify how was their journey and what they are feeling, whether they are happy, whether they are sad, whether they are frustrated, whether they have very much depressed. In the same way, in the healthcare setup also, when a patient comes to the hospital for the first time, we as nurses, when we encounter the patients, we used to ask, so for what purpose you have came to hospital, what made you to came to hospital, so what are the symptoms do you have, so what are the precipitating factors, how you are feeling now, or when did the symptoms start. So this is a simple term, that is history taking. So once we do the proper history collections from the patient only, we'll come to know what is the exact symptoms they are having and what diagnosis we has to do from the healthcare side, and also we'll come to know what are the medication they are taking, do they have any past health history, do they have any associated symptoms, or immediately we need to give any healthcare attention or not, like that we will come to know. So we'll see one by one in detail. History taking is an important aspect of health assessment and to evaluate health status of an individual. History taking is a stepping stone to know and to monitor the growth and development of the children. So when a history taking, that too for the pediatric population, we do as a nurses history taking in order to identify their growth and development. So how steady the growth and development is. So growth is a quantitative term. We can ask by measuring their weight, height in centimeters and weight in kgs and pounds. In the same way, we will come to know what are the development they are having, how their psychosexual development is, how is their psychosocial development is. Once we do the history collection only, we'll come to know the patient, that is a child, how their language development, whether they are having receptive language or expressive language in that term. So history collection is an important tool in identifying the exact condition of the child. So it is a stepping stone to know or monitor the growth and development of the children. So once we do the history collection only, we'll come to know how the child talks and how painful the child is, like that. Then history taking, getting the information about the health status of an individual is known as history taking. History regarding child's health condition is to be obtained from parents, guardian or caretaker, so whom they know much about the child's health condition. When we as nurses do the history collection, they will tell like, yes sister, since 4 days my child was having a fever, since 3 days my child was having a dryness of lips and mucous membrane, and since 1 day my child is having diarrhea or vomiting, like that. So once we do the proper history collection only, we'll come to know the exact condition of the child. Next, purposes of history taking: to obtain the data of a child to help in diagnosis and treatment, to formulate individualized plan of care. It helps to establish relationship with the child and family. So if we do the history collection only, we'll come to know how understanding the family is and how the caretaker know about the signs and symptoms and health condition of the child. To access the understanding of the family members about the child's health. It helps to correct the misconceptions. So once we do the history collection only, if they are telling some myths and facts, then we'll say no, not like that, according to health status, according to the research data, this is false assumption, like that we can tell them. So misinformation of the family regarding the child rearing practices based on their cultural and socio-economic patterns. So each and every social status and cultural backgrounds, they have their own understandings, and they understand in their own ways due to the cultural differences. So once they are ventilating those emotions and feelings to us only, as nurses will tell them, so as per the research data, it is a false assumption, so it is not being considered as a result. So without any statistical data we cannot say, like that we can tell them. So prerequisites of history collection. When we are doing the history collection, that too for a pediatric population, we have to prepare, that is physical preparation of the room has to be done. So how we can do the physical preparation is a well ventilated room, a well lighted, and the seating arrangements for the child and the caregiver and the doctor, and there should be a separate table in order to do the examination of the child. And also we have to provide various play activities and play therapy area, then play articles to the child in order to reduce the anxiety of the child, because it is a new place. So automatically the child will ventilate the anxiety. So in order to alleviate those anxiety, we are going to provide a play therapy articles. And the same way there should be a materials to record the history data, that is either computer should be there or a pen and paper should be there. So once they are telling, we can just take the notes and we'll come to know what are the shortcomings the baby is having, what are the symptoms the baby is having, what are the how to approach the baby in a proper way. So next is approaching the caregiver or the parents. So first once they encounter into the room where the history collection is being taking place, we have to greet the patient and the child and the caregiver. Next, maintain a warm, friendly, unhurried, informant and relaxed attitude throughout the interaction with the family. That means as pediatric nurses, we must be a good listener. We should not just make a hurry-burry in collecting the information. So once we have to make the parents or the caregiver to ventilate their feelings, emotions and everything. Next, assess the quality of the parent-child and parent-parent interactions while recording the history. Next, use open-ended questions and avoid making judgmental comments. So, avoid making judgmental comments means we itself will tell, oh, is it paining for you? Like that, if we ask means automatically the child will tell, yes, it is paining for me. So, we should not ask in that way. We have to ask like, how you are feeling now, like that. And in the same way, not only to the child but also to the caregivers also we have to do in a same way. It should be non-judgmental. So next is approaching the child. How we have to approach the child is when we go near the babies, with the stethoscope or white coats or the white aprons and all, the baby will have very anxious and the baby will ventilate a fear. So in order to reduce that, we can use colorful uniforms, and when we go to them, we can take any play articles with us in order to do any examination or history collection. Next is like we can make a very good rapport with the patient or the child by just tapping on their posterior part of the chest and on the head, like that. If we do is like we provide a warm environment to the child in order to make the baby comfortable. So if it is the newborn means we can give a small cuddling to the baby. So before giving to the caregiver, we can do a small cuddling, or just like we can just lay our hands on the head and arms of the toddlers and preschoolers, and this will convey a warm therapeutic relationship between the nursing personnel and the child. So whatever the age may be, whether it is a newborn, infancy or toddler, preschooler or school age, even the adolescent, when we do this when we do the history collection by approaching the child in a very pleasant manner, by smiling to them, because when we do in that way only, they will ventilate whatever they are feeling inside, whether they are pained, whether they are frustrated, like that. It will be easy for us to collect the information. Next is performing health history. The basic information we collect is what is the child's name, what is the age, sex of the child, address, name of the informant, time. In case of hospitalized child, we have to mention the name of the unit where the baby is being hospitalized, bed number, registration number or the inpatient number, IP number. Next is date and time of admission to the hospital. So these all are the basic information we collect. Next is chief complaint. So chief complaint means once the baby comes to the hospital for a particular reason, right? So that reason is known as chief complaint. It should be in a chronological order. That means that is fever since 5 days, then headache since 3 days and vomiting since 2 days, means from the descending order we have to go. That is known as a chronological order. And in the same way, when we collect the chief complaints, it should be in the words of the patient. We should not use any complicated language in that. Next is history of present illness. That means what is the, for example, if a child is being came to the hospital for a purpose of fever, so we'll ask them, or pain, means what is the quality of pain, what is the quantity of pain, severity of the complaint, a time sequence, how often you get those symptoms, and what are the aggravating factors, and what are the symptoms you have now. So for example, PQRST. So P is a precipitating or provoking factors, Q is a quality and quantity, then R is a then S is severity, then T is time, and R is resting. So what and all they are feeling the symptoms is, we can just ask the in history collection. Next is history of past illness, that in the sense like medical or surgical illness other than present illness or accidents, allergy, radiations, medication if any. For example, they would have taken the medications during their past times or during the previous hospitalization. So we can ask them, so what all medications you have taken, so do you underwent any major surgeries, do you underwent any accidents, like that we can ask. Next is personal history. So in personal history we ask about how their hygiene is, how is their sleep pattern is, how is the elimination pattern, exercise, rest, do they have any hobbies or special talents, and do they have any behavioral problems like thumb sucking, nail biting, pica. So pica I have already uploaded video, so kindly go through it. So schooling to be collected. Next is family history of illness, like in their family do they have any hereditary disease or congenital anomalies, like hereditary disease like diabetes mellitus or hypertension, any cardiovascular diseases. Next, congenital anomalies means, do they siblings, did they have any congenital anomalies, do the child have any congenital anomalies, do the family members have a history of congenital anomalies. We can ask from the patients, that is caretaker of the child. And in the same way, in family history we will also ask about, do they have any, if they have any past health history, how do they take any medications during their day-to-day life, or any other treatment they are being taking, whether they are taking the allopathic treatment or any ayurvedic treatment, like that we can ask. So each and everything about the family we can ask. So by collecting the family history only, we have to frame out the 3 generations pedigree chart. So pedigree chart, which consists of the footnotes, that is each and every symbol symbolizes about the health status of the family members. Next is socio-economic history. So socio-economic history, so according to Kupusamy socio-economic status, we will classify the patient whether they belong to high classes or low class or middle class, like that. So what and all we'll ask in socio-economic histories is like whether the child belong to a rural family or urban, or housing, what is the type and location of house, what is the water supply in their house, what is the waste disposable they are taking, communication facilities, recreational facilities, like financial condition of the family, that is who is the breadwinner of the family, then how many family members do they have any associated symptoms or any hereditary disease. And then we'll ask about the cultural beliefs regarding the child. So each and every cultures have their own beliefs regarding the child rearing practices, so that and all we have to ask. And also we'll ask about how is your ventilation, and do they have open drainage system or not. And then we will ask if is your house is nearby the hospitals, like that we will ask. Next is birth history. So birth history, that contains the details of prenatal, intranatal and perinatal, so neonatal, postnatal information to be collected. So maternal disease or medications during pregnancy should be collected. Presentation, that is mode and place of delivery, first cry after birth, feeding difficulties during neonatal period, birth weight and gestational etc. should be recorded. And also we'll ask about what is the mode of delivery, and do they faced any complications during the intranatal period or postnatal period or during the antenatal period, and how was the period of their pregnancy, how the baby had Apgar score, whether it was normal, whether what is the score of that Apgar, we can ask them. Next is developmental history. So developmental milestones up to 1 year. After 1 year, any developmental delay is to be collected. So history of growth and development assessment is like we will first assess their anthropometric measurement, that is height, weight, length and dentition. So how many teeth do they have? Do they have primary teeth, that is milk teeth, that is deciduous teeth, and do they have in dental caries, and we'll also ask about their important milestones, like in case of infant we'll ask from first month to 12th month how the milestone was, like first month social smile, second month who's and vocalizes, like that till 12 month we'll ask. Then toilet training, whether they have started the toilet training or not, like that we can ask if the baby is in toddler period. So next is, so I have already discussed, no, like by collecting the family history only we'll collect like the members of the family. So then we will frame out the pedigree chart, that should be genetic diagram, that should be constructed till the 3 generations. Next is habit. We as a pediatric nurses ask about whether the child attends the school regularly or not, how is their behavior pattern, how they interact with their friends and colleagues, and hobbies, interests and personalities of the child, how it different from the others. And we also ask about their eating pattern, sleep pattern, toilet habit of the child. Next, adolescent children should be encouraged to talk regarding their worries, anxiety, psychosexual difficulties and substances. Next, we'll be seeing about the dietary history. So what we will ask, if the baby is less than 2 years, or 2 years means we'll be asking about the breastfeeding, how often they are breastfeeding, and when did they start their weaning. So what are the foods they are providing in the weaning food, and do the child or mother have any feeding problems, dietary patterns. Next is weight gain, everything. So if a baby is born, so birth weight has to be doubled by 5 to 6 months and tripled by 1 year. So like that we will ask, so whether it was in a steady gait or not, like that. Next is calorie requirement, according to the age group, according to the recommended dietary allowance, whether they are intaking the proper balanced food or not, like that we will ask. Then illness should be enquired, dietary intake before the onset or during the illness has to be encountered. Next is, we have to ask the 24 hours dietary pattern, that is from before 6 a.m. to the next morning 6 a.m. what and all they have consumed. So we will compare it with the recommended dietary allowance, and then we will if they are following, they are in the proper BMI and proper health status, we will not do any modified diet. But if they have any overnutrition or deficiency of the nutrition, we as a nurses will provide them a modified diet plan in order to improve their nutrition status. Next is allergic history and immunization history. So in allergic history, we will be asking about whether they have any allergy towards the food or any drug, because once we know priorly only, we can prevent the major symptoms, signs and symptoms or major complications from the child. Next is immunization history, that is we'll ask about the immunization status. So as per the chart, whether they have immunized their child, what was the previous dose, what is the next dose we have to give to the child, and what all dose has been skipped, and what is the reason for skipping those immunization, and we'll impart the knowledge regarding the benefits of immunization if they are very younger child, like that. Next is, this will help us to diagnose the major signs and symptoms and give a comprehensive nursing care. Next is anthropometric measurements. So anthropometric measurements means we'll check the weight of the child by weighing scale, beam balance or electronic weighing machine, that is for the child and the adult. So when we are doing checking the weight of the child, the minimum clothing should be there. So if they are wearing so much of boots and coats, means that itself will be in about half to 1 kg. So we have to avoid that and all. We should encourage, we have to teach the caregivers that minimal clothing should be there, like that. And after doing that, proper documentation should be done, and we will see that their health card is being properly maintained or not. Next is maintenance of growth chart is very much important. So once we call the child, we do the anthropometric measurement, and again we have to insist the family members to come again. So after that, we will be just applying it on the formula degree of malnutrition, that is actual weight by expected weight into 100. So by doing this, we will come to know how the baby is having the steady growth. Next is health, length and height, that is if a child baby is not able to walk, if we are checking their length, that is known as length. If a baby is able to stand and stand in the stadiometer and measure, means that is known as height. So height improvement indicate the good skeletal growth. At birth, length of the healthy newborn baby is 50 centimeter. It increases to 60 centimeter at 3 months. So this is the small height and length indicators. Next is body mass index, that is BMI is an important base to assess the general growth and deviations like malnutrition or obesity to the child. So body mass index is equal to weight in kilogram by height in meter square into 100. So by obtaining this value, we'll come to know whether the child is in overnutrition, that is obesity, or undernutrition, that is malnutrition. So if a BMI is more than 30 kg per meter square, it indicates obesity, and if it is less than 10 kg per meter square, it indicates the malnutrition in the children. So once we measure the anthropometric measurement, and we'll employ it in the degree of malnutrition and body mass index. Next is system wise, we'll be asking the history collection. So gastrointestinal system, mainly they will ask about what is their appetite, do they have any nausea or vomiting, abdominal pain, bowel habit, nature of stools, passage of parasite, etc. Next, in urinary system, we'll ask about in what age they have started the toilet training, what is the frequency of urination, do they feel difficulty while urinating, that is known as dysuria, do they have any blood during the urination, that is hematuria. Next, in musculoskeletal system, we'll be asking about do they have any sprain, pain, fracture, joint pain, any swelling, deformities, do they have any limitation in their range of motion exercises. Next is nutritional requirement. So required calorie as per the recommended dietary allowance, will be assessing their by encountering their 24 hours dietary recall, will come to know how much total energy they are consuming, carbohydrate, fat, protein, calcium, iron, vitamin A, and what is the malnutrition status, whether they are undernutrient or they are being overnutrient like obesity. If they are in obesity, in which category of obesity they belong to, like that. Next, we will be identifying that by doing all the history collection, we will next go for the proper diagnosis by laboratory findings like checking the hemoglobin levels, stool examinations, urine examinations, then biochemical test, then radiology. Then after by proper history collection only, we'll come to know how far we are going to do the diagnosis. Once we do the proper diagnosis only, we'll identify the proper treatment of the disease. So only we have to do, as a nurses, proper history collection should be there. So we should not skip each and every topic of the history collection is very much needed. That is from the chief complaint to present health history to past health history to family history, then what socio-economic history, then birth history, then personal history. Each and every history is very much important in identifying what is the exact condition is. Then system wise examination should also be done. So that's all about the history collection. So once we do the proper history collection only, we will come to know like what diagnosis we have to do. So once we do the proper diagnosis only, a prompt treatment can be done. So once we do the prompt treatment only, the patient will have a good prognosis and the patient can be discharged from the hospital very soon. So history collection plays a vital role in the patient's health status. So as a pediatric nurses, we must, and that too for the pediatric population, we must be very patient and we should be active and good listener, and we should not interpret any informations or we should not be any judgmental. So we should be actively listening to them and we have to motivate them to ventilate whatever the feelings they are having. So that's all about the history collection. Kindly like it, share it and subscribe it. If you have any doubt, drop down in the comment box. Thank you for watching.